Stem cells are used a lot now in orthopedic procedures. And when we talk about stem cells, we're usually talking about mesenchymal stem cells. These are multipotent stem cells, and they are able to differentiate into different types of tissues. So in orthopedics, we would like for them to differentiate often into a muscle cell or maybe a cartilage cell. And also, these multipotent stem cells are able to help out even at a local level. And so the types of stem cells that are used most often in the orthopedic realm are what we call autologous stem cells. Well, what does that mean? Well, autologous stem cells mean that it comes from you and it goes back to you. And there are two types of autologous stem cells. The first type is what we call bone marrow stem cells, okay? And so a patient will have a bone marrow aspiration. We will concentrate those stem cells, and then we will re-inject that back into the patient for whatever injury they have, be it a ligament, be it arthritis, be it cartilage, etc. Okay? And the second type of autologous stem cells are what we call fat stem cells. Now, fat stem cells, most people in the orthopedic realm at this point in time are using them mainly as a graft or somewhat of a matrix. And the reason for that is the FDA is still somewhat hesitant on whether or not you can digest the adipose and get the stem cells. That's still considered somewhat of a manipulatory process. And so most of us, if we're going to use fat stem cells, we'll use it as a graft and not as just pure stem cells. So again, autologous is mainly bone marrow stem cells and fat. But I want to contrast that with what a lot of people are calling our office for, and those are the stem cells that are being advertised quite often now. And those are called allogeneic stem cells. Basically, those are umbilical cord stem cells. And again, there are several good properties to those as far as growth factors and matrix and things of that nature. But the only issue is there's really not a whole lot of stem cells by the time they get from the umbilical cord to the provider who's going to be doing the service. And people will say, well, how does that happen? There's so many stem cells in umbilical cord. And the answer is, well, that's true. However, you have to remember that when you get an umbilical cord, you first have to extract the stem cells, and that requires putting in a collagenase, which is an enzyme to break it down, okay? So if you have 100% stem cells initially, and then you use a collagenase, maybe you have 70% after that. You're going to lose some along the way. Then you take those stem cells, some of them viable, some not, and then you're going to cryopreserve them. So you're going to freeze them. And then you're going to thaw them. And even oftentimes, you'll irradiate them to get rid of pathogens and things like that. So by the time you do all of those different processes, put them in a different medium and ship them to wherever they're going to go over the United States, by the time that provider gets them, there's really not a whole lot of stem cells. And even if you do have a few of them, they're certainly much less than when they were when you first harvested them. And if you put them out on a petri dish and you tried to culture them, you'd get very few. And there's a couple doctors who have done this. Actually, Dr. Dan Kibler in Franciscan University, who deals with a lot of placental products, has looked into this, as well as Dr. Chris Centeno of Regenex. And both of those two individuals, individually and independently, I might add, both come to the same conclusion. So again, I'm not saying there's not some good to the umbilical cord stem cells, but to advertise that there's a whole lot of stem cells is factually probably not correct. So here at Tennessee Regenerative Sports Medicine, what we do is we do the bone marrow stem cells, okay? So what we will do is we will aspirate stem cells, usually from the back of your hip, or what we call the ilium, okay? And then once we draw out those stem cells, we will prepare them, and then under ultrasound guidance, we will inject those stem cells into the damaged tissue to promote healing. And we use stem cells for many reasons. We use it for osteoarthritis of the knee or the shoulder, or if someone has a really bad tear, stem cells do a very nice job at the reparative process.